In medical school, I was taught to first ask patients about the symptoms that brought them in, like a chief complaint and review of symptoms. Instead, the approach of the infertility industry, also called assisted reproductive technology or ART, often focuses on which cash pay procedure the patient can afford. Here are the words many couples hear when they walk into an REI clinic or reproductive endocrinology and infertility clinic. You haven't been able to get pregnant. Well, we could go straight to IVF, or you could try IUI, intrauterine insemination, first to get a discounted rate on IVF. Look at this chart of how your egg number is drastically declining with age. Urgency, fear of one's inadequacy, and need for a quick solution rush over the woman who has held one negative pregnancy test after another. The REI physician will likely explain the IVF procedure within a 30-minute appointment. These couples who go with the IVF program will soon be faced with discarding poor quality embryos and hearing about embryos dying in the petri dish. The doctor will need to decide how many embryos and on what days he will perform the embryo transfer in the procedure room. The husband is separated completely from the creation of the new life while the woman is alone in the procedure room. The couple will then need to decide to either freeze or destroy the extra embryos. The high pregnancy complication rate is generally glossed over. The idea of the actual pregnancy seems intangible at that moment. The hard questions are often forgotten. What if they get triplets? They risk losing all 3 babies. They may be advised to selectively reduce the pregnancy, which means aborting one child to decrease the risk of losing all 3 children. But on the forefront of the woman's mind as she walks into the clinic is the fear of the loss of the family she has dreamed of. She is wondering, why is this happening to me? Why am I failing at something that most, including me at one time, take for granted? My goal in this video is not to judge the couples who have used these methods, nor the intentions of some of the medical professionals involved. Instead, I want to educate you regarding the risks of this approach and the poor medical evidence for it, along with the possible risks of poor pregnancy outcomes. Additionally, I would like to offer a better treatment approach that treats the underlying cause of infertility. It cooperates with the woman's natural reproductive system and offers couples healing both emotionally and physically. What IVF does and doesn't do. Infertility is a symptom that there is something else medically wrong. The approach of IVF is to bypass the underlying cause of infertility. IVF is done by overriding the body's own hormones with high-dose hormone injections, overstimulating the ovaries, possibly causing mild discomfort to life-threatening ovarian hyperstimulation syndrome, harvesting multiple eggs from the woman and collecting the man's semen after masturbation. The semen is spun down and the egg and sperm are combined out of the body in vitro. The embryos are then inspected. If they meet criteria, one or multiple embryos are placed in the uterus of the woman. If the embryos don't meet criteria, sometimes based on merely gender or eye color, they are discarded. Instead of implementing more medical treatment to fix the underlying cause of infertility, IVF circumvents this step. The cause of infertility, for example endometriosis, often causes other issues such as inflammation and low hormones. Chronic inflammation and inflammatory markers or low progesterone can lead to adverse pregnancy outcomes such as a miscarriage and preterm birth. The IVF procedure itself does not treat these problems. It is also well known in the medical community that every single complication of pregnancy is increased with IVF, from preeclampsia to ectopic pregnancy and multiple gestations. It can even increase the incidence of hysterectomy at time of delivery. Even singleton pregnancies from IVF are 2.4 times more likely to die, 2.99 times more likely to be born before 33 weeks, and 3.78 times more likely to weigh under 3.3 pounds. Women with infertility struggle not only physically but emotionally, setting them up for a higher risk of a diverse pregnancy outcome. To me, is just heartbreaking. What IVF does to women and couples. A couple I know spent over $200,000 on IVF. Round after round failed. They are still getting bills to this day. They have no baby. They have no money left for adoption. Take Jessica Hepburn, now a well-known activist. She lost her sanity in her marriage to 11 cycles of IVF. She ended up with 6 pregnancy losses. She even had a life-threatening ectopic pregnancy. She also refinanced her mortgage and went into massive debt, spending tens of thousands of dollars. If couples end up spending all of their life savings, it had better be a proven system. These women are desperate. They are willing to shell out enormous sums. Forbes estimates $15,000 to $18,000 per cycle. And on average, it takes 3 cycles for even a chance to hold a child in their arms. Oftentimes, patients do not know the numbers. The actual success rates are not widely known. Since IVF's inception in 1978, there has been time and money for research. Since then, the improvement in live birth rate per cycle has gone from 22.3% in 1995, 33% in 2003, and 31% in 2015 per the CDC. Most women are not getting help. In the U.S., the CDC estimates that 7.3 million women aged 15 to 44 have used infertility services. In 2015, there were 91,090 cycles. Some women had more than one cycle, and 21,700 live births from fresh, not frozen, non-donor eggs or embryos. That means that less than approximately 1.2% of infertile Americans accessed services that year with their own eggs with IVF. This also means that only 0.2% of all infertile women in the U.S. actually had a live birth as a result of IVF with their own egg or embryo. Let that marinate. So, 98.8% of women facing infertility did not access fertility services, and 99.8% did not get a baby from those services. These numbers demonstrate that a huge population of women don't have access to IVF due to the high costs and are scared of the invasiveness or side effects, or morally opposed to sacrificing their own embryos at a chance for pregnancy. As a medical profession, we need to do more, and we can. The fallopian tube formula answer. The fallopian tube formula system simply uses holistic medicine to find the root cause of infertility and help resolve it instead of bypassing that process. Take Sarah's mother, who tried IVF 4 times. After 3 years of failed attempts, Sarah's mother found the fallopian tube formula system. Dr. Jody, was able to find the root cause of her infertility, and she got pregnant within 3 months and carried Sarah to term. Hers and numerous other success stories can be found on our success stories page in the link in my bio. And our success rates of live birth, not just pregnancy, vary from 65.4% to 84.8% depending on the condition treated. Even if women don't get pregnant, nearly every patient achieves an improvement in her health in the process, whether it be pelvic pain from endometriosis, PMS from a hormone deficiency, or completely resolving the symptoms of PCOS. If a couple does get pregnant, they don't face the many complications of high-risk pregnancies from IVF, are not told that their embryos are dying in a petri dish, nor risk increased chances of birth defects or watching their triplets die after delivering early at 22 weeks, as I have seen as results of IVF pregnancies. Even if they have suffered through failed IVF cycles, I don't want another woman to suffer. I want her to truly heal emotionally and physically with the medical breakthrough of the FTF system. FTF is the affordable, safe, and effective alternative to IVF. Do you know someone who wants to have a baby but is having a hard time getting pregnant? Maybe I can help. Go to ftfsystem.com. I've helped hundreds of women. Maybe I can help you too.